presentation as approaching this springtime picture of my beautiful country, Iran. I'm Dr. Trife Ghasemi. I've got a BDS degree from Azad University and a laser fellowship from Genoa, Italy. We conducted a research thanks to our mentor, Dr. Chini Fush in Tehran, Iran. The title of our article is Photo-disinfection of orthodontic brackets contaminated with Lactobacillus acidophilus with blue laser. Before I start, I'm going to briefly explain two important keywords in our article. The first one is dental laser. Laser, the word itself, stands for light amplification by stimulated emission of radiation. A coherent light that all the waves are in the same phase. And the most popular laser in dental treatments is diode laser. The other keyword is photodynamic therapy. It's a two-stage of treatment. We have a light source and a light sensitive material that absorbs the light, and as soon as it absorbs the light, it's going to be a toxic material or a part of tissue that is not desirable for us. The introduction. As we all know, dental caries is a multifactorial disease that addressing each of these contributing factors would prevent development of dental caries. Cariogenic bacteria plays an important role in creating these dental caries, especially Lactobacillus acidophilus. As a cariogenic bacteria, play an important role in thickness and formation of the biofilm plaque leading to a dental caries. Orthodontic patients have braces, appliances that these parts increase the risk of biofilm retention. Besides that, the length of treatment is long in these patients, so we need to create a method, a treatment that would decrease the risk of biofilm and dental caries in these patients. We have conventional methods for treating these dental caries in orthodontic patients, but they have some side effects. For example, fluoride agent like Fluoxetine mouthwash has some undesirable side effects like discoloration or ulcer and burning. So we introduce PDT as an innovative and less invasive treatment method. We use photosensitizers, natural ones, curcumin and riboflavin. Curcumin is derived from turmeric, daily routine spice that we use, and riboflavin, another one that is extremely biocompatible. These two photosensitive materials can be exposed to blue diode laser. BDL as a light source in our article emits light with a wavelength of 450 nanometer and stands for coherent light radiation. There is a lack of evidence for the efficacy of APDT with blue diode laser. So we're conducted this article to evaluate the efficacy of APDT. The aim of this present study is to investigate the effects of BDL on disinfection of orthodontic brackets contaminated with Lactobacillus acidophilus. This was done considering the importance of situation of patients receiving orthodontic treatment and the potential of APDT as a non-invasive, safe, and simple technique. What we exactly did on the method and material part was first sample preparation. We prepared 36 teeth that were extracted from orthodontic patients, that all the patients have complete satisfaction. Polished the dentin surfaces, rinsing under water, and disinfected the teeth with chloramine dissolution. Then we did culture condition and biofilm formation. The culture condition was done by inoculating Lactobacillus acidophilus in MRS and incubated under specific conditions. Then we had the bacterial suspension. After that, we exposed the enamel slabs with bonded brackets. We contaminated enamel slabs with bonded brackets with Lactobacillus acidophilus. Then we categorize those 36 teeth to 6 groups of 6 teeth. First group was control one. The second one is riboflavin alone. Then riboflavin plus VDL, curcumin alone, curcumin plus VDL, and the last one was chlorhexidine group. After categorizing, we exposed, irradiated the curcumin or riboflavin with VDL. The power of our laser was 500 milliwatt, and these two groups were exposed to VDL. After that, we did the statistical analysis by SPSS statistic, and we used p-value as a significant cutoff. Then the result was about that. The curcumin group and riboflavin group that were exposed to blue dye laser were significantly effective, and they reduced the number of Lactobacillus acidophilus. Chlorhexidine group completely destroys all the bacteria, but riboflavin alone was not very effective and does not significantly reduce the number of Lactobacillus acidophilus. The main finding of this study is that curcumin plus blue dye laser as a new device was able to reduce the number of colony formation units per milliliter of Lactobacillus acidophilus around orthodontic brackets. Riboflavin and control group were the same approximately, but riboflavin plus VDL with a radiant power 500 milliwatt was able to significantly reduce the colony forming units per milliliter of the bacteria. As you can see, there were some agreements and disagreements about our result. The ones that they do not align with our result, there are some differences between our articles. For example, Arajo light source is LED, but ours was blue dye laser. Maybe that's why our results does not align. There are some influencing factors that would influence and affect our results of study. Chemical properties of individual photosensitizers. For example, some properties like hydrophilicity, electrical charge of different material would affect the result. Also, susceptibility of the different bacteria. For example, in some cases and studies, we have seen that S. mutans is more susceptible to photodynamic therapy in comparison to the other bacteria. And another factor that is considered an influencing factor is the radiant power of blue dye laser. For example, in some studies, we have seen that target frequency of radioflavin different doses and different powers, they found a greater reduction of eta calis when the VDL blue dye laser has the power of 500 milliwatt. So the power of our laser matters. The other influencing factors include phototoxicity of curcumin, different timing, reaching maximum efficacy, and concentration of photosensitizers. For example, if you use more of a curcumin or another photosensitizers, the result will be different. Why we need more studies? The brackets we use in this study was contaminated just with a single kind of bacteria. This is totally different and cannot simulate the oral cavity because we have multi-species in our mouth. So we cannot generalize this result to the clinical one. So beside that, this study was in vitro. In mouth, this situation and the condition is totally different. We cannot consider the plaque formation, immune system, salinity, temperature, and the factors like this in vitro. So we need clinical researchers in future. And what should be considered in future studies? The variety of microorganisms, value of the curcumin or riboflavin content, various parameters of blue dye laser, clinical researchers. Future clinical studies are needed to investigate the use of natural photosensitizers plus blue dye laser as adjunctive therapy to reduce the presence of cariogenic bacteria and improve clinical outcomes. In this article, and what we did, we concluded that Lactobacillus acidophilus, the second most common cariogenic bacterium, is susceptible to curcumin and riboflavin plus BDL with a rating power of 500 milliwatts. These characteristics make blue dye laser a potential option for clinical use, but the efficacy of APDT using blue dye laser with curcumin and riboflavin needs to be investigated in future clinics. As a general dentist that has experience the use of laser in my own practice in clinics, I have seen the patients that they are more pleased and satisfied when we use laser for soft tissue surgeries like crown lengthening or frenectomy. So I believe that already patients are afraid and they don't like our treatments. They don't like dental clinics. They don't like dentistry. We can use these non-invasive treatments as a replace for our invasive treatments and make the patients more pleased and more eager to come to our clinics for preventive, for prevention. I mean, most of the time they are scared and they don't come in the last stage. So APDT as a technique that is non-invasive and safe would be a future alternative for our conventional treatments. Thank you.
Is there any questions or comments on this presentation? Okay.
Thank you for nice presentation and exam. What about API mechanism? You tried it before?
My fellowship is just dye laser, in soft tissue laser. I don't know, Arium, I think it's for hard tissue, for the bone and the teeth.
Yes, it is for hard tissue, and I read a lot of papers about recycling of rackets and removal of composite.
Yes, the bonding, the brackets.
Yes,
yeah, they
yes,
use it.
and it is a good one for you have any experience about it?
Unfortunately not. My experience is just limited to using dye laser for soft tissue.
Thank you very much.
Thank you.
One more question or comment? Okay, thank you so much.